Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. Acupuncture has been used by Chinese healers for thousands of years, but Western physicians don't understand how or even if it works. This is the People's Pharmacy with Terry and Joe Graydon.
When acupuncture was first introduced to this country several decades ago, conventional medical practitioners were skeptical. Now there's research evaluating both its safety and its effectiveness.
Acupuncture has been used for everything from headaches and osteoarthritis to menstrual cramps and hot flashes. Is there science to support its effectiveness? Can acupuncture be integrated with 21st century medicine to overcome hard-to-treat health challenges?
Coming up on the People's Pharmacy, we talk with two practitioners about the art and science of acupuncture.
First, this news.
In the People's Pharmacy health headlines, pomegranates have a reputation as superfood, and it may just have gotten a boost. Researchers in Switzerland have found that a compound called urolithin A, derived from pomegranates, can boost performance in old mice. Gut bacteria make urolithin A when they metabolize a pomegranate component, elagitanin. Other fruits and some nuts also contain elagitanin. The mice given urolithin A were able to run 42% longer than those who did not receive the compound. Experiments in laboratory worms found that the worms exposed to urolithin A did not accumulate dysfunctional mitochondria as other aging worms did. They also lived longer. No one knows whether aging humans will also derive benefit from this chemical, but the first clinical trials are expected to begin next year. The hope is that healthier mitochondria will lead to better muscle function in old age.
An epidemiological study of around 1,000 children born between 1972 and 1973 in New Zealand suggests that those who bit their nails or sucked their thumbs when they were little were less likely to develop allergies as they grew up. The parents were asked to assess nail biting and thumb-sucking behavior at various ages, 5, 7, 9, and 11. They were then tested when they reached 13 years of age and again when they were 32. 38% of the kids who had sucked their thumbs or bitten their nails tested positive for allergies. That compared to 50% of children who had not. The researchers are not recommending that parents encourage either thumb-sucking or nail-biting, but trying to break a child of such habits may no longer be so urgent.
People with red hair, fair skin, and freckles are much more sensitive to the sun. Now, geneticists have determined that the gene that causes red hair and pale skin that burns easily is MC1R. Having 2 copies of this gene results in an increased risk of skin cancer, comparable to spending 21 years under the sun. This genetic susceptibility explains why redheads must be especially careful about protecting themselves from the sun's UV radiation.
Hops are the seed cones of the plant Humulus lupulus. They give beer its distinctive flavor, but an extract of hops may play a role in breast cancer prevention. Postmenopausal women have been taking hops as a way to treat hot flashes without hormone replacement therapy. Scientists at the University of Illinois tested an enriched extract of hops to determine how it affects estrogen metabolism. They used tissue cultures of human breast cells that are sensitive to estrogen. The medicinal chemists used 4 different compounds isolated from hops and found that one of them was associated with a detoxification pathway. This might lower the risk for breast cancer. If hops can ease the hot flashes and other symptoms of menopause while reducing the risk of breast cancer, this natural treatment might benefit many women.
Cancer treatment can result in long-lasting fatigue, but Michigan scientists have found a technique that might help relieve it. They recruited 288 breast cancer survivors who were still feeling significant fatigue at least a year after completing treatment. The women were randomly assigned to one of three groups: usual care, which served as a control group, a group taught to do acupressure on relaxation points, and a group taught to do acupressure on stimulating points. The average fatigue score at the start of the study was 5 out of 10 possible points. The self-administered acupressure took 3 minutes a day. After 6 weeks, more than 60% of the women in each acupressure group had lowered their fatigue scores into the normal range, compared to 31% of those in the usual care group. This benefit lasted for at least another month. There was no significant difference between the two acupressure groups, although women using the relaxation pressure points had better sleep and better quality of life scores. About 12% of the women dropped out because they found the acupressure practice too time-consuming. The only side effect reporting was bruising in 2 women. The investigators conclude that relaxing acupressure offers a possible low-cost option for managing symptoms. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. What do you know about acupuncture, other than it's an ancient healing tradition from China? Western medicine has yet to embrace this approach, in part because it represents such a different way of thinking about health in the human body. Although there are roughly 25,000 articles in the National Library of Medicine referencing acupuncture, there's still some mystery about how or even whether it actually works.
To help us understand acupuncture and how it can be used, we turn to 2 experts. Remy Coiteau is an associate professor in community and family medicine at the Duke University School of Medicine and Duke Clinical Research Institute. He's co-founder of Chapel Hill Doctors Healthcare Center, and he's on the board of directors of the Society for Acupuncture Research.
We're also talking with Dr. Chelina Erickson. She's a doctor of Oriental Medicine and licensed acupuncturist who practices at Chapel Hill Doctors Healthcare Center.
Dr. Coiteau, Dr. Erickson, welcome to the People's Pharmacy.
Thank you. Very nice to be here.
Thank you. It's a pleasure to be here.
So let's start with, what is acupuncture? Dr. Erickson, most people have heard about it now. It's not quite as mysterious as it used to be, but give us a sense. What are we talking about?
Well, acupuncture is a complete healthcare system that was developed in China anywhere between 2,000 to 4,000 years ago. Some scholars feel like it was developed during the Stone Age and may have come from the practice of the draining of abscesses with stone needles. And there is definitely evidence of stone and metal needles that were used a long time ago during the Stone Age. It is a system that addresses all imbalances in the body through the use of acupuncture, Chinese herbal medicine, dietary recommendations, and exercise programs.
Well, let's start at the very beginning. Stone needles? I'm having a hard time wrapping my brain around that.
Yes, they're frightening looking, and I've seen them in my acupuncture texts. They were really large, and there was actually 9 different types of needles that were used, and they're nothing like the needles we use today.
What are the needles you use today like?
They're very thin, hair-like needles. They're made out of stainless steel to allow for a relatively painless insertion.
You mentioned something called imbalances. And, that's not something that we're familiar with, Dr. Coiteau. Imbalance. You didn't learn about imbalance in medical school, or did you?
Not by that name, but it is a real phenomenon, I believe. When you think about the homeostasis is a fancy term for being in balance or where things are working together. And so there are many clinical conditions where things are not quite in balance. You might have an autoimmune disorder where maybe your immune system is acting too strongly, or you may have an immune deficiency. That's a form of imbalance. You can also look at certain symptoms, like with the gastrointestinal tract. You might have more on the constipation side or more on the diarrhea side, those are what we mean by imbalances, where it's not quite right in where the body is working optimally.
But Western medicine hasn't been particularly good at figuring out how to get things imbalanced. In other words, when somebody's constipated, well, we have laxatives, and we sort of let's flush the system, so to speak. Or if somebody has diarrhea, we have drugs that will sort of cause constipation-like stuff. But we're not actually establishing homeostasis. We're dealing with the symptom.
Yes, I think that's very well said. That is an approach that we take in Western medicine. We do try in Western medicine to get to the cause when we can. We try to understand molecular function, but many, many times we do not, and therefore we tend to try to treat the symptoms with the idea of trying to bring the body back to a balance. But as you say, really by just treating the symptoms. Whereas in traditional Chinese medicine and other forms of healing modalities that incorporate acupuncture, they really are trying to get the body in balance so that there aren't the symptoms that are manifested, such as the ones that we talked about. So it is a different approach, trying to get to the body really at its optimal state of health.
Dr. Erickson, do we have any idea how acupuncture works?
There's different ideas about how acupuncture works. The Chinese theory of how acupuncture works is that our body is comprised of these invisible pathways in the body called meridians, and that meridians are not blood vessels, but they are conduits that carry qi, which is our vital energy, and blood throughout the body and also into the internal organs. So meridians are a way to connect the internal organs to the surface, so internal to external, and they can be accessed on the surface of the body at the 365 acupuncture points, where the energy is seen as being more superficial. When a needle is placed in an acupuncture point, the practitioner achieves what's called da qi, which is the arrival of qi. So the Chinese see that acupuncture helps remove obstructions in these pathways, much like removing a dam in a river and letting the water flow. So obstructions in the pathways of meridians, obstructions in qi and blood can cause pain and disharmony and other health problems.
Dr. Cueto, this notion of qi makes a lot of your Western-trained colleagues a little bit nervous because they can't see it on an MRI. They can't find it in their anatomy books. It's like, well, where are these pathways? They're not there, like blood vessels and nerves and the lymph system.
Not to mention, qi seems pretty mysterious. It's hard to measure.
That's very true, but just because we can't find it anatomically doesn't mean that it doesn't exist. There are many phenomena that we can't see. I think an interesting comparison is electromagnetic radiation, which is not something that we can see, but we can measure. We have ways of measuring it. But I think it's helpful to think about an electrocardiogram, which is something that we read. It's a signal that the heart emits. There's basically an electrical magnetic field that's generated by the heart. And when you have an electrocardiogram, you have leads, you have electrodes placed on distal parts of the body, your feet, your arms, and they pick up signals from the heart. That's an example of something that is not visible per se, but certainly gives us signals and gives us information, but may also actually affect our tissues. So if you think of acupuncture and what it does, in addition to the possibility of increasing the flow of qi, which I do believe is a very high possibility, there is the phenomenon that put two metal needles next to each other, insert them in the body in acupuncture points, and you can measure an electric current between the needles. It's just a phenomenon. Electric currents themselves alter the electromagnetic radiation of the body. That's also a phenomenon. So it isn't too much of a stretch of an imagination, I think, to think that these electromagnetic currents or fields that are being generated by these metal needles placed in certain places may actually have effects on the tissues that could be therapeutic.
Now, I think one of the mysterious things about acupuncture is that the needle may go in the ankle to treat something that isn't in the ankle. Can you shed any light on that?
Yes, I mean, that's the connection of the meridian pathways in Chinese medicine. So there is a pathway for every single organ in the body. And many of these pathways run the full length of the body, like the gallbladder meridian, for instance, which is by the eye and runs across the head and back down to the neck and shoulders, all the way down the rib cage and down into the feet by the little toe. So accessing problems in the eye can be treated by needling near the little toe. So often acupuncturists will treat distally and locally. So if there's a problem, they'll treat at the site where the problem is, and they'll also treat distally on the meridian, far away from where the problem is.
So I agree with all of that, and there is more information that's coming out of recent research, which I think is very interesting. There is a field of research now looking at fascia, which is the connective tissue in the body, and they are looking at the effects distally, from a distance in the body, of acupuncture needles. And they have imaging techniques to see what happens to the cells in the fascia at a distance away from where the needles are placed. And if you've ever had acupuncture, you may have noticed that your acupuncturist may have twirled the needle. Sometimes the needle goes in and then the acupuncturist twirls it or spins it a little bit. And that phenomenon, when that's applied under imaging techniques, you can see the cell structure far from the body being affected. There is a tension. The fibers in the fascia actually communicate far across the body, and you can see the cells changing, and they emit different chemicals, and there's this all this phenomenon that are clearly related to a single needle being placed at a very distant part from where the action takes place.
Give us a sense of what you mean when you say fascia. I mean, because I think people have sort of heard the term, but it's like, well, where is it exactly?
Well, fascia is everywhere. It is what holds us together. So we have a skeleton that we're all familiar with, the bony structure, but then we have soft tissues that are held together by fibers, by connective tissue. The term fasciitis comes from fascia. So the biggest or some of the most obvious collections of fascia are in the palms of your hands or the soles of your feet, because there's a lot of needed protection and padding there. That's an example of fascia. But fascia surrounds the organs, is along the muscle planes, underneath the skin. It's a communication system. It's an entire, some people now consider it an organ that communicates very, very effectively throughout the body among itself.
You're listening to Dr. Remy Courteau, Associate Professor in Community and Family Medicine at Duke University. He's also with the Duke Clinical Research Institute. He co-founded Chapel Hill Doctors and is on the board of directors of the Society for Acupuncture Research. We're also talking with Dr. Cholina Erickson. She's a doctor of Oriental Medicine and a licensed acupuncturist.
We need to take a short break. When we come back, we'll find out if those acupuncture needles hurt.
How many needles are needed for a treatment?
We'll also learn about the conditions that do well when treated with acupuncture. Can acupuncture really help ease chronic pain?
We'll get the story on any acupuncture side effects.
And how could scientists do a controlled, double-blind, randomized trial of this kind of treatment?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. The number's 800-345-7339. The website, uttercream.com.
If you'd like to order a CD of this show, you can call 800-732-2334. This is show number 1042. That number again, 800-732-2334. Or you can find it online at peoplespharmacy.com.
Today on the People's Pharmacy, the topic is acupuncture. Is it a historical curiosity, or does it have a place in modern healthcare?
We have two guests on the show today. Dr. Remy Coiteau is Associate Professor in Community and Family Medicine at Duke University. Dr. Cholina Erickson is a licensed acupuncturist and Doctor of Oriental Medicine, practicing at Chapel Hill Doctors Healthcare Center.
Dr. Erickson, I think a lot of people worry about the pain factor. You're going to stick what? Where? Ouch! No way! So how painful is it to get an acupuncture treatment? Maybe for headaches, as a for example. And, you said something about, these are really thin stainless steel wires, but nevertheless, there are a lot of people, myself included, who's not too fond about getting stuck with anything.
Well, I have a lot of clients that come who are new clients, and they have these fears that it's going to hurt. And the majority of clients will experience a sensation often of nothing when you insert the needle. You'll say, I'm just going to put one needle in, see how this feels, and then you put the needle in, you say, did you feel that? They're like, is it in? No. They can't often feel the needle going in because I use a tube. So a tube helps to stabilize the needle and insert it very quickly through the superficial layer of nerve endings. And people feel either nothing at all or a mild tingling or sometimes an aching sensation. I tell them sometimes it might feel like a little mosquito bite. But for the most part, the pain, any discomfort goes away completely within a minute or two, and they're just laying there and feeling very relaxed.
Now, in the world of AIDS and infectious disease, a lot of people are, I think, rightfully concerned about, am I going to catch something? Did you sterilize those needles adequately? So what about the possibility of transmission of disease?
All the needles are sterile, disposable needles, and that is required by the state of North Carolina and every state also. And then the points are wiped with alcohol, and that sterile needles are used, and then they're thrown away afterwards.
So they're never reused?
No.
And there have been no reported cases of any communicable diseases in the last 30 years or so in the United States, to my knowledge.
Now, sometimes when you get stuck with a regular needle, or you have your blood drawn, or you get a shot, flu shot or something, sometimes you get a little infection at the site of the injection, even though they've wiped it with a little alcohol swab. What about catching stuff just because you're penetrating the skin?
Well, in my experience, I've been practicing for 30 years. I've never, ever seen that, not once. Has anyone gotten an infection from a needle? I have seen people get a bruise occasionally. Sometimes you hit a capillary and you don't know it's there, and they get a mild bruising. But that's actually, even bleeding or bruising is very unusual when you're treating people. It's kind of surprising because you're using often many needles and none of them bleed.
Speaking of many needles, how many?
Oh, it depends on the person. It depends on the condition. Could be 10 needles, could be 20 needles.
And how many treatments does it take before a person gets benefit?
Generally, in my practice, I ask people to come once a week for 4 weeks. So for some chronic daily health concerns that people have, or pain, they will often experience improvement from treatment to treatment. So normally they'll experience some benefit from the first treatment, more benefit from the second treatment, more benefit from the third. And a lot of people by the fourth treatment are feeling like, okay, I think I could now come in 2 weeks. And in 2 weeks' time, they might feel pretty good for a week and a half, and then maybe the symptom will come back a little bit. So it's a cumulative thing. It depends on the person and how long they've had something.
It sounds like it needs to be personalized a little bit.
It is very personalized. All treatments in Chinese medicine are individual, definitely.
And what kinds of conditions are most, I won't say susceptible or vulnerable, but, what can you treat with acupuncture, Dr. Coiteau?
Many things. And it really, the way to look at it, I think, is, and I'm going to relate also to the number of treatments, is there's a statement, a feeling that the longer you've had the symptom, the longer it may take to treat. And an acute situation may take a lot less time to treat. Like an acute, so to get to your answer, some of the things that might be treated. Acute swollen ankle, you twist your ankle and there's a lot of swelling there. That can respond very quickly to acupuncture to keep the swelling down. So that's one example. Other acute situations are sinus congestion. Very responsive to acupuncture. That could be a single treatment. You open up, one treatment can open up the openings in the sinuses and allow it to drain, and then you're fine. So those are acute situations that can be treated very quickly. Acupuncture has been used for many, many things over thousands of years, over many different cultures, and so there's a long list of things for which it is used. As for what it is effective for and what is there evidence for, that's also a complicated answer because it depends on how you look at it and it depends on how you're determining whether it's effective or not. So maybe we should begin by what it is commonly used for. In the United States, it's commonly used for pain conditions: headache, back pain, neck pain, osteoarthritis, joint pains. Those are very common conditions. Respiratory symptoms are things that acupuncturists know how to treat, but many patients don't think to go to an acupuncturist for an acute asthma attack, for example. That is, coming back to our earlier part of the conversation, an example of an imbalance where there's an overactivity of in this case, the immune system, and they can be calmed down. So in sum, I would say in general, when you have symptoms of imbalance, I have to come back to that, or something not quite right, acupuncture just might be something that can help the body get back to where it really wants to be. Very general answer there.
Now, one of the things we always like to ask about any treatment, whether it's a drug treatment, a surgical treatment, or anything else, side effects. What sorts of side effects do people report, Dr. Erickson, with acupuncture?
My feeling is for most people, acupuncture is either going to help them or not help them. They don't typically get worse, though after the first treatment, people can have a detoxification effect from the treatment. If they've never had acupuncture before, apparently acupuncture can stimulate the liver to detoxify. People can often feel maybe a little achy or flu-like the next day, tired, kind of depleted, and that usually is a day, and then they're fine. And that typically happens only after the first treatment, not so much in subsequent treatments. Besides that, there don't seem to be side effects from acupuncture that I've experienced.
Now, Dr. Erickson, we just heard from Dr. Cueto that sinusitis can be treated with acupuncture. And this is a very common condition that people often, because they feel so miserable, will go to their doctor and beg these days for antibiotics. And doctors have been told maybe that's not such a good idea right out of the box. Let's just wait a while and see how much worse it gets or if it doesn't go away. And so people leave the doctor's office if they didn't get an antibiotic feeling cheated. And if they did get an antibiotic, they probably got something that wasn't going to work anyway, and now they have side effects with the antibiotic. So it's a big mess. But I think lots of our listeners are going, well, sinusitis, how would you treat that with acupuncture? Where do you put the needles, and how good is it?
I would consider it to be very effective. And I not only use acupuncture, I have to say, but herbal medicine also for this condition. Where do you put the needles? The needles are put in the sinus points on the face. They're also put on meridians that are connected to the sinuses, which would be large intestine meridian. The spleen and the digestion of mucus in the gut is very related to chronic sinus problems. So we always treat not just at the sinus point, but other meridians or organ systems that are involved in this type of problem.
So if I were to look at one of the patients that you were treating for sinusitis, where would I see the needles?
Oh, in their feet, their legs, their hands, their abdomen, their sinus.
Dr. Cueto, the otolaryngologists who are listening right now are going, what are they talking about?
I am not so sure. I mean, I don't know what they're thinking, of course, but really a sinus congestion, when you have sinus pain, sinus pressure, it's largely because the single opening in the largest sinuses in the face, the maxillary sinuses, really just have one opening at the top if you're standing up. and that opening swells up when there's swelling and inflammation. And if you can accept the possibility that acupuncture can decrease swelling, which is very well demonstrated in many cases and is something that I accept as a statement, then it's very easy to go the next step and realize that it's the decreasing the swelling at the ostia, the openings of the sinuses, can allow the drainage. And once you have drainage, you're fine. It's a problem of drainage more than anything else. So I don't think that's that out there.
Well, of course, what your colleagues are looking for are the so-called double-blind placebo-controlled trials. And there have been a lot of them. But it's always like, well, how do you do a placebo-controlled trial? Well, you use sham acupuncture.
Oh, let's talk about sham acupuncture, because this is one of the great mysteries of modern medicine, or of Chinese medicine, if you will, that most of the time when there is a randomized controlled trial, as Joe has just described, you have some people getting actual acupuncture and some people who don't know that they're not getting actual acupuncture are getting sham acupuncture, in which the needle doesn't actually pierce the skin. And usually the sham acupuncture works pretty darn well. How come?
That is a conundrum that we are still working on. If you take the sum total of the good randomized clinical trial evidence in the published literature now, of which there is a lot, and as an acupuncture trialist, I know that literature very well. The studies have been very well designed, by and large, a lot of people, good methods. What we tend to find is that for the conditions for which acupuncture works, of which there are quite a few, acupuncture is significantly better than no acupuncture. So from a perspective of a clinical situation, a clinical question, should I do acupuncture as a patient or should I recommend it as a healthcare provider? There are many studies that'll tell you whether the person is likely to get better if they do acupuncture versus not, and that's compared to no treatment. And that's helpful, that's useful. In that respect, it works compared to not doing it. Now, the question of the double-blind randomized placebo-controlled trial, it gets at the question of, is this observation, this phenomenon that people seem to get better after an intervention, how much of that is due to placebo? And placebo means different things, but basically it's a non-specific response to some sort of intervention. We're still working on that in the acupuncture field. We have many trials that have shown that acupuncture is better head-to-head to sham, but not all. As you correctly mentioned, many of them don't show a significant difference between sham and true. But there has been the most definitive trial, it's a very important trial. It was conducted by what's called the Acupuncture Trialists Collaboration. It is funded by the National Institutes of Health, and it was they looked at 31 high-quality randomized controlled trials. And the investigators went to each of the individual investigators across the world who completed these trials and asked them for permission to actually use the raw data, the individual patient-level data. My study when I was at University of North Carolina, Acupuncture for Headaches, was one of those 31 trials. And we all gave them permission. They did a meta-analysis, what's called a patient-level meta-analysis, which is much more powerful than, and if you'd like, we could talk more about meta-analysis, but more powerful than the typical meta-analysis. Short story to the long short answer is they did find that acupuncture is more effective after doing this meta-analysis compared to sham for the conditions looked at, which were chronic headache, shoulder pain, osteoarthritis, and back pain. And so there is good evidence that acupuncture does something more than placebo. However, placebo responses are probably a big part of it. I think that's the case. As with many interventions, I think placebo plays a part.
Well, again, many of your colleagues go, well, a placebo effect that's fraud. That it doesn't count because it didn't really work. It was just something going on in the patient's head that we don't completely understand. Snake oil. But a lot of patients are happy with the results. Mm-hmm. So, Dr. Erickson, let's turn to some cases. For example, somebody comes into your office and says, well, Dr. Erickson, I've got this osteoarthritis. I've had, quite a few birthdays under my belt. My fingers hurt. My knees are in trouble. I've tried the anti-inflammatory drugs, but they eat a hole in my stomach and they raise my blood pressure. Can you help me? What happens? What is the end result? How do people fare?
Would you like some actual success stories?
Yes.
I'd like to hear any kind of story.
All
sure.
right. I have a client that I've seen for 20 years, and she came to me 20 years ago at the age of 40, exhibiting onset symptoms of MS, trouble walking, numbness and tingling, weakness, fatigue, and she had had these symptoms for about a year. She was diagnosed by a MRI. She had a lesion on her brain, and she started receiving acupuncture and Chinese herbal medicine and dietary recommendations for her condition. She came for 1 year, and at the end of 1 year time, she was pretty much symptom-free, so she gradually got better and better and better. It took a while. She continued to come to me for 2 more years, like once a month maybe, and then she disappeared. I didn't see her for 3 years. She came back, and she said she was feeling well and feeling strong, and she needed a tune-up. And she has been coming to me for 20 years, about once a month, and she is totally well, and her symptoms have been abated, and she has not progressed with her MS symptoms at all. In fact, all the numbness and tingling has been gone the whole time. So,
but she actually was diagnosed with
absolutely.
MS by a
medical test, MRI, yes. Mm-hmm. And so that's one situation. I have another client recently that came in. She's a new client, and she came to me and said, I am in acute pain, chronic pain every day from a neck injury in May of this year where she herniated 2 discs in her neck from an aerobics class. And she had had a MRI of her neck and x-rays of her neck, and it showed a herniation at C4, C5, and then another one, C6 and C7, with some bone spurring, which has probably been there for a long time. She had chronic pain down her neck and shoulders, unable to move, unable to sleep, unable to do anything. When I see a patient like that, I think, I hope I can help this person. You know, some people I feel more confident. Some people I go, well, let's try it. But she just had her 5th treatment the other day, and she is 80% better and feeling wonderful. And her symptoms, even though she has herniated discs, her symptoms have subsided greatly.
You're listening to Dr. Chelina Erickson, a licensed acupuncturist and doctor of Oriental medicine who practices at Chapel Hill Doctors Healthcare Center. We're also talking with Dr. Remy Coiteau, associate professor in community and family medicine at Duke University. Dr. Coiteau is on the board of directors of the Society for Acupuncture Research.
After the break, we'll find out what research tells us about acupuncture's effectiveness.
Find out more about the range of conditions that acupuncture might help.
Does acupuncture need to be used as part of a larger system?
Are there problems acupuncture can't help?
We'll also get the inside story on a trial of acupuncture for hot flashes in menopausal women.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Thanks for listening to this podcast of The People's Pharmacy. If you like it, why not rate or review it in the iTunes store? We'd appreciate it.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of utterly smooth foot cream with shea butter, helping dry, cracked feet feel utterly soft and smooth. 800-345-7339, online at uttercream.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1042. That number again, 800-732-2334, online at peoplespharmacy.com.
Today we're discussing an ancient Chinese healing tradition. Acupuncture has been used to treat a variety of health conditions from headaches and back pain to osteoarthritis and menstrual cramps. Coming up, we'll find out about some new research demonstrating the impact of acupuncture for alleviating symptoms of menopause.
Dr. Remy Coiteau is Associate Professor in Community and Family Medicine at Duke University. He's on the board of directors of the Society for Acupuncture Research. Dr. Cholina Erickson is a licensed acupuncturist and doctor of Oriental Medicine practicing at Chapel Hill Doctors Healthcare Center.
Dr. Coiteau, we understand that you have been doing research. I wonder if you'll tell us about the acupuncture research that you have done.
I would love to. That's what I'd like to do most. I began doing research on acupuncture when I came to the University of North Carolina. I was a Robert Wood Clinical Scholar at the time, which is a training program for people who want to become clinical scientists. And I was interested in headaches, and I was trying to figure out where I could make my mark as a junior investigator in the headache world. And I was reading studies, and I came across studies of acupuncture, and I became very interested in the studies that were done that suggested that acupuncture might be helpful. But the studies were small, they hadn't been well funded, they hadn't been well designed. So that became something of interest of mine to see how can we design the best studies we can. So that was why I became interested in acupuncture. My first clinical trial that was funded by the National Institutes of Health and was conducted at the University of North Carolina was for people who have chronic daily headache, who were being seen at the UNC Headache Clinic at the time. So people who are seeing the best doctors that we have available, who are in what we call tertiary care. They were seeing specialists. And those patients who we recruited from that clinic and those who wanted to try acupuncture were enrolled in this clinical trial. It was a randomized clinical trial between comparing true acupuncture, personalized, however the acupuncturist felt was appropriate, versus no acupuncture. So really it was looking at the effectiveness of acupuncture as an adjunct to medical care, and that showed very good results. Patients did much better. The acupuncture helped them decrease they improved their quality of life, and they reported feeling much better. So that was my first experience. Right around that time, the acupuncture field had blossomed internationally. There were many very, very well-designed clinical trials, mostly out of Europe, in England and in Germany. They're the two countries where they had the most studies, very large studies, very well-designed. More headaches for headache, chronic headache in England, and also tension-type headache and migraine in Germany, knee osteoarthritis, also rhinitis, allergic rhinitis. And all of those studies were advancing the field. They had what we talked about earlier. Many of them showed that most of them showed acupuncture was better than no treatment. Many showed that they were either the same as sham acupuncture or just a little bit better than sham. And so that really got us all thinking about what do we do next? So that's my personal interest in that. As far as clinical effectiveness then, so for headache, it's pretty clear. Any chronic daily headache, migraine, tension-type headache, acupuncture seems to be effective. I would like to add for your listening audience something about systematic reviews and meta-analyses for those of you who may have heard the terms. But a systematic review is a study that's done by looking at studies that have already been conducted, usually randomized clinical trials, but it doesn't have to be, but mainly individual studies. And then a systematic review will look at everything that's published and pull it together and will summarize the findings. That's what a systematic review is. A meta-analysis is when you actually take the findings and you quantitatively pool them or put them together. So I just want to make a point of that. And there have been many for acupuncture.
And a meta-analysis essentially allows you to construct, as it were, a little bit synthetically, a much larger trial than the original smallish studies were able to gather together.
That's exactly right, and that's the benefit of a meta-analysis. So you have individual studies, each of which has its own problems. Nothing's perfect. And even if you did everything you did the best as you can, there's certain inherent bias to whatever study you have. And so if you have several studies that are similar in the clinical condition, the intervention, the outcomes measured, then you can combine those studies and get a bigger and more powerful one. So yes.
And what do those meta-analyses show us about acupuncture for a variety of conditions?
I would encourage anybody who's interested to go online and Google. The name is Cochrane, Cochrane. Cochrane is the name of a person. And it's a collaboration of people, it's Cochrane Collaboration, who conduct systematic reviews. And there are many, many of acupuncture. So I wanted to direct people, if you wanted to just Google Cochrane review of acupuncture for whatever, you'll see what's been done. There is so much research that's been done that I can't really easily summarize it. I would just say that there are many conditions for which acupuncture has been shown to be highly effective, and there are many conditions for which it has not. And it just takes a while to kind of look and see. But those systematic reviews are a very quick and good way to get to the best summary of the evidence.
Well, let's go back for a moment, Dr. Erickson, in your experience, and then Dr. Cueto in your review, to just highlight what conditions are most amenable and which might be, less successful.
Digestive disorders are very amenable to treatment with Chinese medicine.
Such as?
Heartburn?
IBS.
Okay.
GERD, abdominal pain and discomfort, constipation, diarrhea, so chronic bowel problems.
Can I say one thing there,
yes.
just along this? There's a great term for GERD, for heartburn, that the Chinese use, or traditional Chinese medicine, rebellious qi, which I love. It's qi going the wrong way.
So they don't think of it as an absence of proton pump inhibitors and too much acid.
No, they think of it as too much heat in the stomach, and the heat that is built up in the stomach from the inflammation in the stomach from possibly faulty diet has drafts upwards, and it carries the stomach acid with it. And so they don't even think that it's too much stomach acid. It's the heat rising up into the esophagus from the stomach.
I guess the acupuncture might also be accompanied by recommendations for dietary changes?
Definitely, yes, and herbal medicine.
I think that's a really important point. Acupuncture is part of a larger tradition. At least for traditional Chinese medicine, acupuncture is only one. Happens to be the part that seems to be getting a lot of attention in the Western world for a number of reasons, but it is only part of many approaches.
So, digestive problems. What else?
Menstrual problems, definitely PMS, dysmenorrhea, painful periods, absence of periods, infertility. Infertility is much more challenging than the other things, but I've certainly helped a lot of women to have a child, who are infertile. All pain conditions, from headaches to, like Remy said, neck pain, back pain, knee pain, osteoarthritis. Allergies respond quite well.
And we've already heard about sinusitis. What about insomnia?
Insomnia, yes, definitely. Insomnia can be challenging, but insomnia does respond to Chinese medicine.
It is interesting that many people sleep during a treatment. Many people, even non-nappers. That's not a treatment for insomnia. But it is interesting that a response to acupuncture treatment is to have a restorative nap.
What doesn't it work for?
So there is much that we don't know. There's a lot of things that we haven't studied. So I'm now talking from a perspective of a researcher looking at the evidence base, which is very different than the perspective of a patient or a provider, because that's just a very different perspective. The list of things for which it has been shown to be effective is relatively short, which leaves many things for which the research is unknown. So I'd rather just quickly give the ones that I know there's research evidence for which it's effective, which are many of the pain conditions, allergies, menstrual disorders, dysmenorrhea, and many GI conditions. And I'm sure there are others, but that's pretty much the short list for which we have actually conducted well-designed clinical trials. Much of the rest is yet to be determined.
Now, we recently encountered a study of acupuncture, in this case electroacupuncture, for hot flashes in breast cancer patients. Now, breast cancer patients do frequently have horrible hot flashes, but they can't take estrogen, which is the usual treatment for a woman having hot flashes due to menopause, because, of course, estrogen feeds breast cancer, or it could. So they need to avoid it. And this study showed that the electroacupuncture was very helpful in reducing both the frequency and the intensity of the hot flashes. Is there other research related to hot flashes?
I'm glad you asked. So I have been the principal investigator and co-principal investigator of two large randomized clinical trials funded by the National Institutes of Health. The first was a collaboration with Dr. Nancy Avis at Wake Forest University, and then somebody else at Mass General Hospital and when I was at UNC. That was a smaller study funded by the National Cancer Institute with the idea of enrolling mainly women who had breast cancer who couldn't take hormonal therapies. And that was a smaller study. It was a pilot study. It turns out to have been big enough to show that there was a significant improvement of acupuncture versus no acupuncture and versus no sham acupuncture. But we didn't use the electroacupuncture. Electroacupuncture sounds maybe a little bit scary than I think it really is. It's really, it attaches, when somebody does electroacupuncture, it's regular acupuncture, but with a small current going through some of the needles. So this research that just came out, the one that you just reported, is a very important finding that corroborates previous findings. There was a very large study that was done out of Scandinavia, hot flush study, which also showed that acupuncture was effective.
And of course, a hot flush is just another word for a hot flash.
Exactly. Dr. Avis and I and colleagues have also just completed a much larger National Institutes of Health sponsored randomized clinical trial of acupuncture for menopausal hot flashes, which again showed that acupuncture is highly effective compared to no acupuncture. This time we did not use the sham treatment because that's not what we were interested in, actually. We wanted to know what it was like in the real world. So we tried to simulate actual practice. So rather than come up with a research protocol that we had everybody go through, we wanted to make it look as much like clinical practice as we could. So we identified 4 very experienced clinical acupuncturists in the community, gave them free rein. Say, you can do whatever you think is best. Do as you would normally. Here are women volunteers who have frequent hot flashes. And that study was conducted over a course of 6 months. The women in the study could have up to 20 acupuncture treatments during those 6 months. And then we followed them for another 6 months. So it was a 12-month study. It was a 1 year. But at the 6-month mark, there was a crossover. So the women who didn't have acupuncture the first 6 months were given acupuncture the second 6 months. And the findings are very, very, very striking, very robust, showing that as soon as they got acupuncture, within 3 treatments, they did better than the control group. And within 7 treatments, they reached as a group at least, their maximum benefit. And then they maintained that over time.
And how did they describe the impact of the acupuncture? Was this something that people thought, wow, that's really working, or sort of a little better than nothing, but not that great?
That is a really good question for which we don't have the answer for that, because we're trying to get to that. Part of what you're asking, or part of the answer to that, is what is an important difference? What change is meaningful for people who have any intervention? And that's an unanswered question as of now. So we're trying to actually get to that with these data, but it's not that easy to do. What we do know is what we took as a standard, a 35% reduction in either the number of hot flashes over a period of time or the impact or severity, that we consider to be meaningful. And that's what most other researchers at least think. And that's what we found with this 35 to 50% reduction. And so we are assuming that is meaningful, but we don't really know.
I mean, it is good news in the sense that a lot of the current treatments available for hot flashes have unpleasant consequences. Mm-hmm. I mean, estrogen has been associated with cardiovascular things like heart attacks and strokes, and of course, the possibility of cancer. The antidepressant medications sometimes are hard to discontinue. So having something like this that you can bring out would be very beneficial. And I suspect that a lot of women would be interested if they believed it really worked.
Yes, I would think so as well. The magnitude of effect is comparable to all of the other treatments that have been shown to be effective.
How could a person who is interested in undergoing acupuncture find a qualified practitioner?
Qualified practitioners would be licensed by the state in which they practice, and many people find practitioners through referrals from friends of theirs and other people who have been to someone they trust and know, but everybody practicing should be licensed in their state, whether they are a doctor or a licensed acupuncturist.
And the take-home message for our listeners, whether they're health professionals or patients?
that Chinese medicine, acupuncture, herbs, and dietary considerations are very effective treatments for many chronic health problems that people suffer from and haven't found good answers for. And, encourage people to seek out that type of therapy if they're wondering how they can get relief from their symptoms.
And Dr. Cueto.
So I'm a physician by training, a family physician by training. And for me, from my perspective as a healthcare professional from that background, I find acupuncture and other alternative approaches, but specifically acupuncture, to be a potentially very, very helpful supplement and complement to the care that I may be able to provide in my medical practice. And I think people should be considering it that way as part of their overall care.
Dr. Remy Cueto, Dr. Chelina Erickson, thank you so much for talking with us on the People's Pharmacy today.
Thank you. It's been a pleasure.
Thank you very much.
You've been listening to Remy Cueto. He's an associate professor in community and family medicine at the Duke University School of Medicine and Duke Clinical Research Institute. He's co-founder of Chapel Hill Doctors Healthcare Center. He's also on the board of directors of the Society for Acupuncture Research.
We also spoke with Chelina Erickson, doctor of Oriental Medicine and licensed acupuncturist. She practices at Chapel Hill Doctors Healthcare Center.
Lynn Siegel produced today's show. Al Wodarski is the engineer. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Red X Industries, makers of Utterly Smooth Extra Care 20 Cream, with 20% urea for extra skin protection. The number's 800-345-7339. The website is uttercream.com.
If you'd like to purchase a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334 to make that purchase. Today's show is number 1042. That number again is 800-732-2334. You can also find it at our website, peoplespharmacy.com.
And when you visit our site, you can check out information on prescription drugs, herbal medicines, and home remedies. You can share your thoughts on today's show and let us know if you've ever tried acupuncture and how well it's worked. You'll also find a link to Dr. Cueto's research on hot flashes.
And the title of that study is Acupuncture in Menopause, a pragmatic randomized controlled trial. It was published in the journal Menopause, June 2016. When you go to the website, you could sign up for our free online newsletter or the free podcast of the show. That way you could listen at your own convenience or share it with a friend. You know, it's all there at peoplespharmacy.com.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks very much for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.
Raise your hand if you want your nails to look perfect all the time. Me too. I'm Sarah Gibson-Tuttle from Olive & June, and this is exactly why we created the Mani System. We wanted to make it possible for everyone everywhere to give themselves a beautiful manicure at home. With our tools and our long-lasting polish, each manicure with our Mani System comes out to just $2. That's right, $2. No more $30, $40, $50 manis that you get at a salon and they take hours. Now you can paint your nails on your time and love them more than ever. And by the way, when people ask, who did your nails, where did you get them done? You're going to proudly say, I did them myself. Get 20% off your first Mani System with code DIYNail20 at oliveandjune.com/DIYNail20. That's code DIYNail20 for 20% off at oliveandjune.com/DIYNail20.